All right, Ben, I want to talk about social anxiety disorder. Probably one of those disorders that many people identify with having. I think it's sort of entered the
the ether.
of ordinary language. Oh, I have
Yes.
social anxiety. Obviously, when folks say that, they're typically not talking about a diagnosed
This is a big
illness.
one. Yeah, this is a big one.
What is it to you?
So social anxiety is a fear of interaction with people, with places, in some ways open spaces, whether that's a public forum where you're speaking, a party, a baseball game, football game, even work environment where you have, meetings or whatever. Social anxiety is absolutely debilitating. You freeze. You have fear that people talk about having fear that people are seeing them naked. That their words aren't really coming out the right way. They're seeing things that really aren't there. They start to sweat. They have a physical reaction to it, and it's very painful to have it. It's very painful to watch. The other thing that I wanted to mention is that sometimes people miss the boat with social anxiety disorder. Sometimes it's not so much social anxiety disorder. It may be another disorder. For example, autism, forms of autism are associated with anxiety and the social phobia. So you have to be careful to assess the patient and make sure you get the right diagnosis. Again, it's one of those things. Anxiety is one of those disorders that we've discussed that, it's generalized anxiety disorder. That's good. And you get lazy and you miss the boat that, okay, we've got some social anxiety, but it may be autism, or it may be a form of autism, maybe on the spectrum in some way. So you got to, as a clinician, you'll be very careful.
So is it fair to say that if you had pure social anxiety disorder, that and no other sort of variation of anxiety in a hypothetical, that you would not be experiencing anxiety if you're in a room by yourself, but then you go into a social environment and now you experience anxiety?
Correct. Yeah, correct. It's
usually not that clean. I
get what you're saying, but it's the association of being part of something else, part of something bigger. The sense of losing control, the sense of just not, almost like an outer body experience. People have reported feeling like they're hovering over their body. Yep. They're watching themselves in a social situation. All they want to do is run.
Yep.
They just want to get out of the situation. When in fact, in reality, they're doing perfectly well.
Yeah.
There's
a sort of a mismatch between their perception of how they're coming off in a social environment and how they actually are.
And when I talk to, patients and families and everything in social situations, I explain a few things to them. Number one is it's probably 95%, but 80% of people don't listen to what you have to say anyway.
So they're thinking about themselves.
Right. Yeah, they don't. So they're not going to get hung up on your stuttering or whatever else. And also 80 to 90% of people have their own social anxiety or their own thing going on. So it's the sharpness in which a person hones in on it, and the baseball bat that they use on their own head it's torturous. I want to hug them. I actually I don't know if you, but I like when somebody's doing like a public speaking and they mess up a little or they stumble. It's very humbling. First of all, it's very hard to do that, and it makes you human.
Yeah,
like I enjoy that.
Yeah. Is there a difference between social anxiety and being an introvert? And the reason I say that is because I always viewed myself as an extrovert. In recent years, I've actually determined I'm more of an introvert in the sense that I prefer for me to recharge. It's not by going out and talking to people. It's by sort of being by myself.
Yeah.
But I don't think I have social anxiety.
Right.
So they're different, right?
Completely different. One has nothing to do with the other.
Yeah.
You because you're an introvert absolutely does not mean that you have some type of social anxiety.
Sure. So you can be an extrovert with social anxiety.
Yeah, you're 100%.
Yeah. Yeah. One of the things I love about how you run the program here is that you always talk about the social rehabilitation.
Yes.
And so just the fact that there's other people who are like-minded, who are trying to do what patients are doing, fosters relationships and connection. And that can be part of re-entry into feeling like you're part of life.
In fact, I'm glad you brought that up. I could argue that the real treatment here really occurs at housing. When a person, that's where they eat, that's where they sleep, that's where they hang out, they exercise, they go to meetings, they go to outings. To me, group therapy and group process is always going on in treatment, on the bus, on the van, during dinner, go to a meeting, at the gym, wherever the group is, that's where it's at.
Yeah.
And you can tell a lot about somebody's diagnosis based on that behavior.
I remember 10 plus years ago when I got better, and just the fact that I started to have those belly laughs again and like go to the diner with some guys that were trying to do the same thing that I was doing, and the little things that I sort of never really thought would move the needle for me really did, because social life represents connection.
Yeah.
And so it's super critical outside of treatment and in treatment.
I want to make a point about that. That, what you just said, is it. We have to connect with someone or a group of people in order to survive. We are social creatures, and that's by nature. By nature, we don't do well in isolation. We don't. You isolate some of these people, come back in a week, see what happens. We are social creatures, and that's why the social rehab and the family component and forging relationships is critical to the success of patients that come to Sylvia Brafman.
Yeah, awesome. Love that. Thank you.